So remember, guys, when I told you there are going to be some times in doing a podcast where I just have to be straight to the point and I'm just going to start winging some things. And so that is kind of a little bit about what today is going to be like. I came across a topic that I found really interesting as a conversation among some nursing students. And one of the things that I thought about was when I was a nursing student, some things that concerned me when it came to that dreaded thing, pharmacology. And so I wanted to give some commonly missed concepts, do a little bit of an intro review with hopes that I can better assist you guys into getting where you need to be. So one of the things that I realize is that many of the times individuals or students aren't familiar with a drug label. And I think that that's why nationwide, one of the biggest problems within the nursing field is that there are more than 50% of errors related to medications. And so one of the things that I realized even in looking and reviewing a group of students and studies that show that students still struggle with that, nurses still struggle with that. And so I'm just going to go with that. So understand that you need to know what your drug label is about. Your drug label includes a lot of information. It includes the trade name of the medication. It's usually followed by that R with a circle. It can be capitalized or it's written in bold. And then you have your generic name. Now, sometimes you'll see lately that some of your medications just used only the generic name, and that's okay to find. So you have your trade name, you have your generic name, but then you also have the strength of your medication. That tells you the amount of weight in units per measure, whether it be in capsules, tablets, or milliliters. It tells you the total um, strength of that drug. Then you get the form in which that medication is provided to you. Again, you'll see tablets, capsules, liquids, suppositories, or ointments. The next, you're going to see the route of the administration. Is it an oral medication? Is it something that's topical? Is it an injection or an IV? And you're going to see that on that label. Then let's talk about the total amount or volume of the medication that's provided in that container, which is different than the total strength of the medication. So the total amount of medication or volume of medication provided within the container can be given to you in milliliters or it can be given to you in capsules. So you have a bottle and it has 250 capsules total in it. Next, you need to pay very close attention because sometimes medications, although maybe in liquid or powder form, they may have additional instructions on there. So is there instructions telling you to mix the medication or prepare the medication? If that's required, then you should give that your attention. The next thing that I really want to just do is go over with you some things to think about. So you get your label. If you have a book that has a label on it, or if you pick any medication in your closet, can you recognize what that generic name is, what that dosage strength is, how many tablets is going to be there? I want you to get in a habit of doing that. So if you happen to be in a skills lab, go into the skills lab, find a medication, look over it. Or if you have a book that's related to pharmacology, find one of them labels and look at it. One of the things that's really, some other things that are important that people miss is the 6 rights of medication. Now with the 6 rights, you need to make sure that you're looking for the right drug, making sure you have the right dose, the right route, the right person, the right time, and the right documentation. Remember, administer only what you prepare. And that's a good thing. Only what you prepared. If someone else is preparing it for you, and I don't find that very helpful. Be familiar with your medication. What's the desired response to the medication, the side effects, the average dose, and any safety precautions. Make sure you're documenting those medications carefully and evaluating the patient's condition before and after. Make sure you're using good hand hygiene before administering the medication and removing gloves in between your patient. Review the medication administration, um, especially if there's an expectation that there's supposed to be some learning with your patient. Allow them to kind of explain it to you or do it. Assist them to give you that teach back so that you know that they know what to do for themselves. Remember your different sites, especially when it comes to IM medications like your deltoid, your vastus lateralis, and your ventral gluteal. And then making sure you use the Z track. Those are some things that sometimes I see nurses forget those in the hospital. But you need to know your different types of drugs. Now, we already talked about having the right med, dose, route, patient, documentation, and time. But another thing that I have found is that individuals don't understand that conversion table and how they move that decimal point 3 places to the right or 3 places to the left. So one of the things that I found like very useful was something that said to help me remember my metric conversions, which was King Henry died unusually drinking chocolate milk. And so it kind of gave me an idea of which direction I'm going to go in as far as moving my decimal point if I needed to know what that was going to be as far as measurements of unit. However, one of the things that I find common is understanding this. Your milligrams is always your smaller number. Your micrograms is your larger number. So if I have 25 milligrams of a medication, then I know that I'm moving my decimal point to my right to give me a larger number. So if that helps you guys kind of remember that, then that would be useful to you. Another thing is understanding what household equivalents are, like as far as metrics is concerned, and knowing what 5 mLs is, which is a teaspoon, and that 15 mLs is a tablespoon, 30 mLs is an ounce, 240 mLs is your standard 8-ounce measuring cup. 1 kilogram is 2.2 pounds. 2.5 centimeters is an inch, and 1 foot equals 12 inches. And a lot of this, just know there's a measurement that we use, and you'll hear that in the hospital a lot, cc's. Well, cc's are equal to mLs. So if you get an idea, I always know that 240 cc's or mLs is in 1 cup of 8 ounces. So if I can break that down to 120 being 4 ounces and 60 mLs, and I said 250 mLs equal your standard cup, 120 mLs is your half a cup, then I know that 60 is my quarter cup. And then I also know that there are 3 tablespoons. Is it 3 tablespoons? 3 tablespoons in every. Now here I am. But know your measurements. That's what I'm going to say. I was getting too deep into that because I'm also a baker. So I'm going to stop there and not go any further. But make sure that you know those things. And I keep another conversion chart too of my tables. That 1 cup is 16 tablespoons. A half a cup is 8 tablespoons. A quarter cup is 4, and so on and so on. And so kind of get in the habit of kind of knowing if 8 ounces is a cup, then 4 ounces is a half a cup, 2 ounces a quarter cup. Kind of help you with your math there a little bit. I didn't do so well in that, but I'm hoping that you guys were able to catch back up with me. All right, so what are some other things that I want to talk about? I want to talk about a commonly missed thing that I'm seeing, especially lately, is the fact that individuals don't double check their calculation. Make sure that you're double checking when you're practicing. Practice those calculations, and then make sure you're having somebody double check your information. And I'm going to be honest, I used to think that going to the back of the book and getting those answers was really going to help me. It really didn't. It did not help me unless I used it correctly. So I really had to learn how to work and do those math problems myself. So just some things that like you keep in mind is try to get somebody else to do it with you and double check your information. And then when you guys are both like unsure as to what to do, then go to the back of the book and look your answer up. But just remember that when you're doing medication math, that sometimes you or all the time, what's important is looking at the question and letting it tell you what the dose was ordered and how much is on hand, how much of it you're supposed to be giving. And if you can learn how to do those equations, if I can fit something in the description that fits in there, I'll try to type something up for you guys to kind of help. But if not, maybe one day, depending on how many people that we get to start subscribing and giving feedback, that I might be able to offer you more information hands-on in another way. Okay, but keeping on, other things that I have found to be important is making sure that you take time to practice your calculations. That's going to be really important for you. Making sure that you're paying attention to the instructions as to whether or not it wants you to round up to the nearest tenth. If it asks you to put in a whole number, look to see whether or not it's asking you to put in mLs or not. Make sure your unit of measurement is also correct, because if you don't do that correctly, then you're bound to have issues. Now, moving on, I want to talk about something that helped me with memorization of my pharm medications, and then this is when I would just call it quits. I did an example, and one of the things that I said was after I made my medication cards, I learned that if I taught back the information, right, that it was easy for me to understand. So one of the things that I'm going to do is I'm going to talk about some 10 topics of things that you want to consider when it comes to making, like doing your pharm medications, making sure that you understand like how to make a drug card, what information I'm going to be focusing on, and then how do you give that teach back to yourself so that you can help memorize it. So just follow along with me for a bit. So one of the things that I want you to know, and it goes back to understanding the label, is when I'm making a medication card, I want to know the generic name and the brand name. I want to know if there's a drug classification and what the therapeutic classification is of that medication, if there is one. Next, I want to know the what, why, and how. That's steps 2 and 3. What's the indication for the medication? What is the medication for? Why is the medication prescribed? And what's the mechanism of action? How does the medication work? Step 4 is knowing the supposed to's, mights, and should not be happenings. Supposed to happen, might happen, should not be happening. So, what's supposed to happen after taking the medication? What might happen after taking the medication? And stick to the top 3 to 5 things that might happen as far as side effects are concerned. And then with adverse effects, what should not be happening. So that's again, step 4 is knowing what's supposed to happen, what might happen, what should not be happening. And those are, in other words, looking at the outcome, what's supposed to happen, the side effects, what might happen, adverse effects, what shouldn't be happening. And then I have my oh hell knows, HAIL, okay? I hope you found that as funny as my class found it funny. But that's your number 5, contraindications. Well, no, I'm not doing this. Or your black box warnings. When should the medication not be used? Majority of the time, you'll see a lot that it's pregnancies, known allergies, hypersensitivities, and other health conditions. And your black box warning is your strictest warning that you can get, and because that comes with an FDA warning. Now, how can a medication be given? And that's number 6, is thinking about the route: oral, IV, intramuscular, topical, rectal, sublingual, and others. 7 and 8 is about the storage of the medication and how it interacts. How should this medication be stored? Is it room temperature? Is it refrigerated? Is it away from heat? And interactions. What medications should be avoided when taking the medication? Are there foods or juices that should be avoided? And then pre and post evaluations is number 9. Pre, what should be done before giving a medication? post? What should be done after taking the medication? An example would be blood pressure medication. I need to take it before, and then I need to take it after to see whether or not the desired effect was what I wanted. Patient education is going to be your important thing. That's your instructions. What instructions must I give the patient about this medication? Are there any precautions, side effects, adverse effects, interactions, contraindications, black box warnings? Then the next thing that you're going to be thinking about is labs and monitoring. What labs will the patient follow up with? What monitoring? How often will the patient need to be monitored? Now I know you're thinking, boy, them 10 things seems to be a lot there. There's a lot of information. But I take that and I put that into a sentence. Well, one, before we get there, making sure this too, make sure you educate your patients how they know it's too much. Did they take too much? Is there an antidote? Know what the signs of overdose are, toxicity, and medical emergencies. What signs and symptoms are they going to have? How is their respiratory, their cardiac, are they asymptomatic? Do I just need to assess them? Like, know those different things when you're looking at a medication. And so we're going to try to put this into practice a little bit. So I like the medication gabapentin. So we're going to put it together. Gabapentin is the trade name. The brand name is Neurontin. It's indicated for seizures and neuropathic pain, and the mechanism is really unknown, but it's believed that it affects the calcium channels and decreasing those neurotransmitters and thus preventing that overfiring that causes seizures. So it's a great medication as a CNS depressant. The side effects include dizziness, drowsiness, and peripheral edema. Adverse effects is hypersensitivity. They can have a rash, and it can affect some of their other organ systems. So depending on what their need is, you will address those. It's contraindicated in those who already have respiratory distress. It's not indicated for contraindicated in individuals who are using opioids, other CNS depressants, or have respiratory impairment. This doses of medication is typically given at 300 milligrams, and it increases with increments to a maximum of about 1,800 milligrams a day. Now, the medication can be stored at room temp. It interacts with other CNS depressants, alcohols, opioids, and antacids. So when I give this medication, I'm really looking for the effectiveness. I know that they're having seizures, so can't really measure that. I can measure how frequently they're having the seizures. Then I can give them the medication, and then I can determine whether or not the medication is having its effect by a reduction in how frequent they're having seizures, or if the medication is being used as pain, I can also then do a pre-evaluation, rate your pain for me on a scale of 1 to 10, 10 being the worst, and if it's 7, and then I give them the gabapentin, and I come back 45 minutes later, and I'm assessing them, and they tell me their pain is down to a 5 or 6, then I know that the medication is having the effect that it should. Now, I'm moving on to my education. I'm going to educate based on the route. I'm going to instruct the patient when it comes to gabapentin not to take their gabapentin within 2 hours of taking an antacid because it messes with the effects of the medication. I'm going to tell them that if they miss the dose, and as long as there are more than 2 hours in between the next dose, that they can go ahead and take it, but not to stop that medication abruptly, and educate them on the CNS effects. So I'm like, there's my medication card. Everything that we went over, all those steps. Now, how do I put it into something short and sweet that, let me go back because I forgot to talk about the labs. There are labs that you have to do with gabapentin, BUN and creat, because it is excreted through the kidneys, and so the doctor may want to monitor that patient and monitor their labs. And then at the end, I'm going to ask my patient whether or not they understand what I've gone through. So, for once, I'm going to give you guys that final step. You've made your drug card, you've included all those steps, those informations, and now you're like, here's the teach back. How do I write myself a sentence that helps me in memorizing the medication? So I came up with this, and I'll try to say it slow enough, but just play back until you get it. But it's these words, and I write these words down. Good morning, my name is, and insert your name. I'll be a nurse today, and the healthcare provider has prescribed, and then you give them the name of the medication to help with and tell them the purpose. The goal of the medication is, and then you tell them why they're taking the medication. Some caution with the medication as a medication class, and you'll state what that medication class is, and then state the side effects or adverse effects that may happen. So I want you to, and then you're going to tell them to state what safety concerns you might have based on those side effects or adverse effects. You're going to remind them to always consult with the HCP first. If there is and then state your contraindication and what to do, and then state if there are any labs or anything that needs to be monitoring, and then end with the assessment understanding. Ask them, do they understand, and do they have any questions? So I can type this, and I'll put this in the description when I'm done with this. So here's how it goes. I just done gabapentin. I'm going to inject all those little spaces that I told you about, and here's what I write myself to help me remember the medication. It's good morning. My name is Lisa, and I'll be your nurse today. The healthcare provider has prescribed oral gabapentin, or better known as Neurontin, to help with those, to grease those frequency of seizures that you're having, and he's prescribed you to take 300 milligrams once a day. It can be taken with or without food, and the goal of the medication is just to reduce the firing of those signals that can cause those seizures. Some cautions with taking this medication, though, as a CNS depressant, is that it can really cause drowsiness or dizziness or swelling. So I really want you to be careful when moving about. I want you to move slowly and be sure to sit back down if you're starting to experience some dizziness. Don't operate heavy machinery or vehicles or take any alcohol or opioids until you actually know how the medication is going to affect you. Make sure you take the medication regularly and don't stop it abruptly, because when it has its own effects, including withdrawal. Always consult your health care provider first. If there's a chance that you might be or become pregnant, make sure you contact your health care provider immediately, as it is contraindicated. Now, your labs say that your BUN and creat is in the normal range. However, if you develop any issues regarding your kidneys, please inform the healthcare provider, as this medication is excreted through the kidneys. As a result, the healthcare provider may continue to monitor your kidneys. Now, do you have any questions? And it's as simple as that. And when I write myself that little paragraph and I interject all those things that I think are important, I have a small paragraph that just puts it in my mind that I forever will always know what gabapentin is about. And so I linked that to, in that paragraph, I said the trade name, the brand name, indications of why to take it, mechanism of action, side effects, adverse effects. I mentioned contraindications, the dosage route, any interactions, the effects, lab and monitoring, and I went on questions. All of that in just that little bit. So try it, give it a try, and see how it works for you. I thank you for joining me in this impromptu podcast. I hope that you do enjoy it. I really want to keep doing this for you guys. I really enjoy having your feedback. Please, please, please subscribe to our podcast. That lets us know that you guys are benefiting from it, so that we can give you guys more. Your feedback helps lead us in a direction that we need to go into. What topics are going to be important? So make sure you leave those feedbacks for us. And until next time, that's the end of the podcast. Stay tuned for lesson 8. That will be coming out pretty shortly.